Hi,
Hi, how are you?
I'm doing well. I'm so glad to have you today.
Yes, thank you so much. I'm so excited to be
Do
here.
you have a pelvis with you by chance?
Oh,
Okay,
yeah.
good, good. Because I forgot mine at work, so I was like, oh crap, I forgot my pelvis.
No, I
So
bought us one for at home too.
yeah, well, I need to, but my kids will probably try to play with it. So
Right.
okay, so I was just chatting with the audience. I'm Dr. Shannon Clark. I'm with Babies Under 35, and I have Dr. Nicole Cozean who's joining me. What are your Instagram handles? I know you have two. What's the?
Yes.
Mhm.
So this is my personal one or personal professional one, Nicole Cozean DPT. And then I own a pelvic health clinic called
Mhm.
Pelvic Sanity.
Mhm.
And we share a ton of patient-centered information over on that as well. So you can go ahead and join there for all things pelvic floor.
Right, and so you're on Instagram on both of those.
Yep,
So
totally.
Nicole is the founder, what she says, of Pelvic Sanity. I have it written down here. She is dedicated to the way physical therapists, because she's a doctor of physical therapy, the way they treat the pelvic floor, and she's also you have a podcast. You didn't mention that Pelvic
I
PT
do.
Rising
Pelvic
podcast.
PT Rising podcast. Yeah. So
Yeah,
I'm really passionate about educating both patients and
yeah,
also practitioners. So
sure. Yes,
that's
yes.
practitioners.
Yeah, so I will say, admit, I have taken a new interest in this whole pelvic floor thing. And it's because of seeing you guys. Because, I'm an OBGYN and I do everything I do is in the pelvis. But honestly, I don't know a lot about what you guys do because we're simply not trained in that.
Yeah.
So, I love having you guys as resources and I like letting women know that you guys are available there. And it's not just women, it's for men too. Men can have pelvic floor problems as well.
Yes.
But what we're going to do today, it's the topic of the discussion is called pelvic pain Pourri. And basically what that means is I have a list of 6 different topics that I want to touch on. I want
Yep.
to first talk about why they're a problem in pregnancy, and then what a pelvic floor physical therapist can do to help with this problem. So the first one I want to dive into are bladder spasms, and I'll give you a little story.
Yes.
When I was going through IVF, it was my last embryo transfer. I was waiting to find out if it took, and I remember waking up in the middle of the night, and I thought my pelvis was just coming out of my body. And I knew, I was already nervous because I was waiting on a 2-week wait, but I knew something was wrong and I didn't even know technically if I was pregnant yet, but I could not even walk. I was in so much pain and it was in my bladder area, right above my pubic bone. I'm a physician. I knew that's what it was.
Yeah.
So I thought either I'm passing a kidney stone or something. It just turns out it was really bad bladder spasm.
Hmm.
And it was awful because I didn't have a UTI and I didn't have a kidney stone. So that's the only other thing I could be. And I also want to add that in pregnancy, women are predisposed to having urinary tract infections. That's why we dip
Yes.
your urine or get that urine sample every visit. And a lot of times, based on what we see in the urine sample, or while we're waiting for the urine culture to come back, or based on your symptoms, we'll go ahead and start antibiotics. And the reason for that is that we don't want to wait to treat because a urinary tract infection in pregnancy can quickly go to a kidney infection, and we don't want that. So, but I will say there are many times when I thought it was a urinary tract infection and it came back, the urine culture is completely clean.
Yeah.
So that leads me to think that a lot of times what this actually is bladder spasm in
Totally.
pregnancy. So what is it about the pelvis and pregnancy that's causing all this bladder? Ugh.
Oh gosh, so much stuff. Okay,
Mhm.
so right, and you bring up a great point that we
Mhm.
do have to rule out obviously
Yeah.
infection, especially in pregnancy, because what you said is so important. However, in the absence of an infection,
Yes.
the little bladder here is under a lot of strain, especially during pregnancy, right? There's physical, right? When your uterus is like gets really big, there's physical pressure
Mm-hmm.
down on the bladder. So normally when we urinate, right, the bladder actually does a little muscle contraction to let us know that we have to pee.
Mm-hmm.
Now in pregnancy, that is a lot of external pressure as
Pressure. Mm-hmm.
well. But the one thing that people don't realize a lot of times is that now, just to orient you guys, right? So this is the pelvis. Hopefully that
Dropped the
doesn't
uterus.
happen. That is not good. So, okay, so right, so your pelvic floor is literally the bottom part, the floor of your pelvis. It
Mm-hmm.
goes from your tailbone to your pubic bone and both of your sit bones. So everything that you see in red can be muscular. Now, if we tip back and now we're looking down into the pelvis, the little bladder here sits right behind the pubic bone, which is why sometimes if you get a UTI, it actually hurts like right above that.
Rub your pelvic. Yeah. Mm-hmm.
Yeah, right. But what's also interesting about that is that these little muscles right here that are part of your pelvic floor can also get irritated. Now, during pregnancy, your pelvis is changing form
Mm-hmm.
quite a bit
Mm-hmm.
to allow for the expansion of baby in there, which is all normal and good. However, right, sometimes if these muscles get strained, they can talk to essentially your bladder a little bit, and that can cause a little bit of a message up to your brain that says like, yikes, what's going on? And then can bladder spasm. So the way that pelvic floor physical therapists can help that is actually helping to figure out and give you guys strategies, especially during pregnancy, to manage that strain a little bit better, right? We can give you a lot of exercises, a lot of relaxation techniques. We can do a lot of things that specifically look at the pelvic floor and why that can be also in giving you some urinary urgency. So
so that, I mean, that's excellent. And I mean, I've had several patients over the course of my career who we thought were having recurrent UTIs, and every time we would send their urinary tract or their urine culture, it would always come back negative. And and listen, I just want to reiterate: if you have signs that are similar to what a urinary tract infection is or consistent with, or when you go in for your prenatal visit, we dip your urine. And this is just a little screening test. We look at a few little things, and sometimes it'll be indicative that there could be a urinary tract infection going on. So we do start the antibiotics because we don't want to wait. But once the urine culture comes back, if it's negative, that's good for us to know. And it's also, you can stop your antibiotics. But if you find that you're having a lot of suprapubic pain and you're being told that you probably have urinary tract infections or recurrent, and they keep coming back negative, it could be that you're having the problem with bladder spasm. So if that's the case, then maybe ask your doc, hey, is it that my bladder's spasming? And should I go see someone like Nicole that can help me, do some exercises or teach me how to help relieve some of that bladder spasm? So do you get referrals like that a lot?
Yeah, I definitely. And then we also get like a lot of people that are just like searching online being like, yikes, what can that be? Right. Because there's a lot of physicians that actually don't think that can happen. But the other thing that's interesting about the bladder, and it's interesting that when you were a little bit in that stressful situation of waiting, the other thing that can cause bladder spasms is that this is like a big, huge, your fight, flight, freeze nervous system, the autonomic nervous system actually has big bladder innervation. So a lot of people with bladder spasms will also report that happens at a time where you're a little bit more like heightened anxiety, stressed, right? And your pelvic floor also has innervations of that same nerve, right? So now we have like 3 different things it could possibly be. It could be the actual muscle in the bladder. It can be the external pressure on the bladder that's causing those spasms. And then it can also be a pelvic floor muscle that is mimicking the occurrence of a bladder spasm. So pelvic floor physical therapy can really help with ruling in and out what we call the musculoskeletal causes of that bladder spasm.
Yeah, but it's important to know that it can happen. And again, OBGYNs are great, but this is not something I don't remember ever being taught that during all that training. So, having you guys specialize in the pelvic floor is amazing because it's doing a lot of good for our patients. So if this is something that you look for pelvic floor physical therapist or pelvic health physical therapist. That's typically how they go if you Google that, and you could find one in your area. And they can talk, and of course, once you rule out that it's not infection, you can, talk to your doctor. Hey, what do you think about getting me to see one of these guys? May or may not require referral based on your insurance. So just check into that. But they are a great resource. So move along the same lines, pain with bowel movements.
Oof.
So listen, your bowels change location. They change orientation as your uterus gets big. Plus, if you're taking iron, you can start to become constipated. So there's a lot of reasons why you might have pain with bowel movements. So from your point of view, and listen, it's not usually due because you're infected or anything. It's just basically anatomical changes that are occurring. And keep in mind, can you just real quick, we're going to digress. If you show the pelvic floor and I think this is always so important to show them how the rectum and the lower part of the colon, the bladder, urethra, and the vagina all go through the same floor muscles.
Yeah. So this guy, right? So we have the urethral opening right here. We have the vaginal opening here. And then we have the rectal opening right here, right? And then, so basically, I'm going to take these little guys out now. These are the superficial pelvic floor muscles. And if you kind of look, they kind of make this big figure 8. And they go from the pubic bone to the tailbone. So these guys are related to painful intercourse. I know you're going to talk to someone about that. And then bladder urethral pain, and then also the pain with bowel movement can be caused by the inability of this guy to relax right here. So we have the two different ways that your bowels can be disrupted, right? They have the peristaltic activity, or the way that they normally go, which is affected by hormones and physical effects during pregnancy. But what also happens is that the rectum is at the end of the colon, right? So now this is, the colon's come down here. It's now going right into here. And it goes through all of these pelvic floor muscles, right? So again, if these pelvic floor muscles are going through a little bit of a challenge, right? Because now baby's growing, now your posture's changing, you're not using your legs in the way that you would normally do. Now all of a sudden, all of your pelvic floor muscles could be a little bit more like, like try to help your pelvis and your spine to adjust to all of the changes that are going on in your belly. And when that happens, when we poop, this is like the rectal opening now, right? When we poop, what's supposed to happen is our pelvic floor is supposed to relax and open that opening to allow feces to go through. Well, if those muscles are either trying to help your back out, because that hurts, or they're just like not very coordinated, or physically are just a little bit too tight, that can cause what we call outlet constipation. And so now you have kind of double whammy, right? You've got like the way that the colon is actually producing the bowels, and then now we have a little bit of tightness here. And so a pelvic health physical therapist then can, number one, assess, is that really happening? Do we actually have a pelvic floor issue to that bowel movement problem? The answer can be yes. And then we can work with some of the muscles and the timing and the coordination of those muscles to relax at the right time when you're pooping. Now, some of your audience may have heard of a squatty potty.
I love the squatty potty.
It's so freaking great.
I have one.
Yeah, man, me too. So, and the reason why that works is because normally the rectum is kinked, and there's this muscle that goes around and makes it like a kink. And the squatty potty puts your knees above your hips. And when that happens, that muscle relaxes and allows this to be more of a straight shoot out, right? So there's a physiological reason why the squatty potty works. But then even if that muscle still has a little bit of a hard time to relax, that's where a pelvic floor physical therapist can really give you some strategies, some stretches, some exercises to help the coordination of those pelvic floor muscles, especially around bowel movement. The other reason why it can actually hurt, though, is because, right, if you look at where those little holes are, right, hopefully everybody can see those little holes. Those little holes are where some nerves come back into the pelvis, right? So if we're getting constipated and there's a lot of pressure in the rectum, it can actually put a little bit of pressure back onto those sacral nerves. And so that's another reason why it can actually be painful to have a bowel movement. And again, a pelvic health physical therapist can help figure out why that's happening in the first place. There's some things in pregnancy that we can change, obviously, and some things that we can't, but at least then we can make that whole system functioning the best possible way that it can be in that area. And that's definitely an area that we can help with. So
along the last thing you said, like I've seen several patients over the years where they were getting constipated because they were probably taking iron, and we all have our different threshold based on what your blood count is when we recommend iron. But then, like you said, you get constipated down that area, then it puts pressure on those nerves, which causes even more pain, which makes them not want to go to the bathroom, which makes the constipation worse. And the next thing you know, they're presenting to the obstetric triage because they think they're in labor because it's hurting so bad. And if you think the bowels move in a coordinated fashion, so it comes and goes, which is like what contractions do. And it's hard to tell. And I've had some pretty convincing where I thought the baby was about ready to fly out, and it wasn't. It was just she was really badly constipated. So you get that kind of cyclical pain as well when you're constipated, because your bowels are trying to push everything out. You're trying not to because it's hurting. And so it makes things worse. But you're pregnant, so you think, well, maybe I'm in labor, and you go be seen, which is the right thing to do. And a lot of times all it was is really bad constipation. So all of that kind of makes sense. And it's better to go get checked out than to wait, because it could always be that you're, in labor as well. So, having that information and knowing and making sure you have regular good bowel movements, especially if you're on things like iron that can constipate you, or any other medication in pregnancy that can constipate you, is crucial. But if you find that you're having, go ahead.
No, go. And I was just going to say, the other thing that we find quite a bit, right, is that if you're also having concurrent bladder issues, urinary frequency, which is sort of normal, right? The volume of urine is increasing. So then you restrict your fluid.
Yeah. And
right?
then you get more constipated. Yeah.
Right. And then you're in this like cycle of like, yikes, we just got it.
Yeah. So, and the next thing so there's multiple reasons in pregnancy why you could have problems and pain bowel movements. Hemorrhoids we're not going to talk about hemorrhoids. It's kind of a little bit of a different etiology. But, if it's particular pain as you're pooping, or you have a history of hemorrhoids, that's something that's different. You got to make sure you talk to your doctor, because they can get pretty painful, and be evaluated for that. They can be external, where we can actually see them when we look at your anal opening, or they can be up inside. So, and that typically occurs mostly if you've had a history of straining. Over the course of your lifetime, you're predisposed to hemorrhoids. If you've had multiple babies, a lot of times women will get hemorrhoids. Hemorrhoids are kind of like varicose veins in your legs that you get over time with multiple kids. You can get it's a varicose veins, essentially, is what it is in that area. So that's another thing to make sure you have evaluated if you're finding that you're having painful bowel movements as well.
Yeah, totally.
Yeah. Do you see a lot of that too, where that is maybe a confounding issue with
sure.
Yeah.
And a lot of things where of course, like, we can't do anything to get rid of the hemorrhoids, but what we can help with a lot of the times is what we call the pressure management, right? So if there's increased pressure, intra-abdominal pressure by breath holding or something like that, we can help with strategies that can mitigate that a little bit. Again, we can't make them go away, but we surely can help symptomatically a lot of the times.
With hemorrhoids. Okay, good point. So let's move along to tailbone pain.
Okay.
I will say I had a lot of that because I had broken my tailbone twice prior to pregnancy. So let's talk about actually what's the tailbone.
Okay.
Because not everybody knows.
Right.
Can assume.
Totally.
What's a tailbone, and what happens during the course of a pregnancy with the tailbone?
Okay. So we have the pelvis here again. This is the front part of the pelvis, your pubic bone. So if we turn it around to the back, the tailbone, otherwise known as the coccyx, is this last little bone right here. It's literally the end of your spine. So this triangle bone right here is called your sacrum. And the sacrum, when you're pregnant, starts to, and especially during delivery, needs to move this way. And then it's also the top of the bottom of your spine. This is the lumbar spine vertebrae number 5, right? Sits right on top of the sacrum here. So spine is above. End of the spine is the tailbone. Now, interestingly, every single one, and I'm talking every one, of the pelvic floor muscles attaches in some way to the tailbone. And so what's really interesting is that you bring up a great point too, where if you have a history of a fall, an impact to the tailbone, or it's been injured in childbirth, then you are automatically more at risk to have pelvic floor problems, because this little guy is now going to be like, yikes, and all of those muscles are trying to protect that tailbone or compensating in some way to get that tailbone to either not move, or it needs to stabilize and heal. So all of these muscles here on this side and all of these muscles here on that side work in concert with each other to sort of create this really cool, like, dynamic tension to the tailbone. And if that's disrupted in any way, then we have asymmetries. It can pull to one side. And that is also where we get a lot of pain with sitting, because as we sit down, right, then now we're kind of sitting right on that tailbone area. So we always ask for, history of tailbone injuries, even back into childhood. Because bowel movements come out of right near there, right? Then there can be, if there's an injury there, even back in the day, then your pelvic floor can kind of have a tendency to be like, a little gun shy in that area. Right. And then if you can see down here, this is the end of the tailbone as well. The cool thing is that a pelvic floor physical therapist, when we do our intravaginal palpation of the pelvic floor muscles, we can actually feel all the way back to the tailbone, which is how we can assess it. Because really, it's hard to do it externally. A lot of times we can get to right about here, but to actually get like underneath it and see, we can do that either vaginally or rectally in order to see what the heck's going on with the pelvic floor and see if that is part of the reason why you're having some tailbone pain. The other thing I want to point out is that this little white section right here happens to be a little bit of a muscle, but what also is right here, there are a lot of ligaments right around your sacrum and your tailbone. And they go, from this area to your sit bone. There's a ton of ligaments here. And because it's so closely related to your back, and that area is expanding as you get further and further into your pregnancy. Those little ligaments can also get really irritated and inflamed and also refer pain down to your tailbone. So one of the ways that a pelvic PT can help is we can actually differentiate. Is it coming from a little bit higher up? It just feels like your tailbone, or is it actually your tailbone? Or is it some of the pelvic floor muscles there that are also making it seem like it's your tailbone?
Yeah, I think the important point that you made is that there's so many players that, when you're having pain in that area, especially the lower back, the sacrum area, or the tailbone, you have to figure out what is the top, or what is the primary initiator, because that can cause a domino effect to a lot of things. So that's where pelvic floor PTs come in, because they're a lot better at teasing that stuff out than like an OBGYN. So one thing I hear a lot is, and I hate saying this, and I have to be honest with you, over 20 years, I've been guilty of saying it too.
Yeah.
It's pregnancy. Pregnancy is supposed to be, it's not comfortable. It's pregnancy.
Yeah.
And we got to stop saying that. We got to stop saying that, because we have to listen to our patients. And for some things, yes, some things it's just pregnancy and it's not going to get better until you deliver your baby. But if you have a patient, or you are a patient who is having the same thing over and over again, and it's, yes, pregnancy can be uncomfortable, but it's not supposed to be painful. Okay. And it's not supposed to affect how you walk. It's not supposed to affect how you poop, how you pee, all those things. It's not supposed to do that. So if that's what's happening to you, you got to look for answers. And if your OBGYN is kind of saying, give me another 4 months and it'll be gone, it may not, number one, it may not be gone. And number two, you probably need to see someone like a pelvic floor physical therapist, so they can help decide if it's really just something related to pregnancy, it'll go away. If it's something else that's going on. Yeah, I'm sure you 100%. See that a lot. Yeah, 100%.
And the other thing, you bring up a great point, which is like advocate for yourself, because you don't have to just accept that that's what that is. And here's the deal, right? There are times when we're just like, yikes, this is kind of as good as we're going to be able to get it right now. But what we are also preventing in that case is for things to get worse. Right? And we're setting the stage. We got to get it. I always talk to my patients about, we want your pregnancy to be as good as it possibly can be from all aspects, right? From the baby's health to yours, as good as it can possibly be, physically and mentally and emotionally, right? And then after we have the baby, then we're setting ourselves up for, again, we had the best physical chance that we could to make it great. And then we're starting then from a better place in the postpartum realm of pelvic floor PT as well, right? So if we let something fester that's painful for a really long time, that can influence how other things are working through the whole lower body and even into the upper body and back. So we want to make sure that we're addressing those things as early as we possibly can, so that we can keep you as active as you can be, that's safe for the baby, and then move forward from there. But you bring up, that's a great point. And a lot of people get brushed off by male and female OBGYNs, and I love that you just said, we just have to nope, just stop that, and just know that in most states, you can actually go to a pelvic floor physical therapist without a direct referral. Okay, now, obviously the pelvic floor PT is going to then assess and probably, try to help talk to your physician, make sure everything's okay from that angle. But most people have what we call direct access in some form of it. So it's kind of nice that way too.
Yeah. So, the takeaway point here is that I want to make sure that, we understand that, yes, pregnancy can be uncomfortable, but again, it's not supposed to be painful, and you're not supposed to be immobile and have such excruciating pain. And the reason why I brought this up, because I remember vividly, I had a patient when I was a resident. Now, keep in mind, I was still learning and I was training. She had to walk with a walker. She was and I, looking back, what it probably was pelvic girdle dysfunction and pelvic girdle
pubic
pain.
symphysis stuff. Yeah.
She had, it was like maybe her fourth or fifth baby, and she had it was progressively getting worse. And now I know what it was. And I just remember they were like, yeah, there's nothing we can do.
Whatever.
And I feel so bad to this day. And this was like 20 years ago, but I was learning and I didn't know what I know now. And I think it's extremely important that we, and if there's any physicians watching this or watch it later, that we have to delve a little bit deeper and take a little bit more time. And if we can't do anything about it, someone like Nicole could do something about it, because we have those resources available. That's what they do. That's what they do all day, every day. And they can help our patients. So, and also advocate for yourself. Please advocate for yourself. There's nothing wrong with that.
100%. Yeah. I mean, and even on that note, right, even if in the worst case scenario, right, we do have to use some sort of assistance to walk during pregnancy, even then, right, then we can still help with other strengthening things that don't require you to stand up and walk, right? So there's a lot of ways to strengthen your pelvic girdle and help mitigate a lot of those symptoms. And pelvic PTs, physical therapists in general are good at that. But pelvic PTs especially, since we deal with the pregnancy stuff.
Yeah, good. Okay, so I have on here hip pain. Now, how in the world is a hip going to be related to pregnancy and the pelvis?
Yes, good question. So a couple different things. So just from a physical change, posture change perspective, as we get bigger in the front, and as our baby grows, then our pelvis has to tilt to accommodate, right? Now this big old socket right here is where the hip joint comes out. As that happens, as the baby gets bigger, we actually lose a little bit of what we call hip extension, right? So when our back leg is back, we actually lose some of that mobility in our hip. So it's really important to make sure that we're trying to keep as much hip mobility as possible in that region. But there are some changes that's just gonna happen. But the other interesting thing and we're talking pain here, the other interesting piece is, so again, pelvic floor, the muscle on this side is called your obturator internus. And so what it does is it's this huge muscle that's like all right here. Most of it is accessible internally. It's this huge muscle. Externally, it's like maybe the width of my finger. Now, it is a cousin to, I call it, the piriformis. So it does the same thing. So the piriformis muscle, or the muscle that is typically irritated in something called sciatica, if you have nerve pain down the back of your leg, then that muscle is back here. It comes this way, but it kind of links up with the obturator internus and goes in the same direction. So hip pain, it can be caused by the obturator internus, which a pelvic floor physical therapist can help. It can also just be caused by lack of mobility into the range of motion that you're losing a little bit because of that you're getting a little bit bigger in the front. And what ends up happening sometimes with that is that the more that we lose that hip extension, the more that we aren't using our glutes as well to contract and stabilize our spine. And so sometimes that can snowball into not only hip pain, but it can snowball into some back pain as well. And so for all of you guys that are listening that, might have been like, oh, I maybe had that, or I have that right now. It can be pain in the front of your hip, right? Which would be kind of more in this like pubic bone range, right? So the front of your hip down into like the groin area can also be hip pain. There can be lateral hip pain, or pain on the outside of your hip, which is where all of the muscles that are trying to stabilize your spine and your hip are attaching to a little point on the outside of your hip. Sometimes that can actually be really painful to lay on your side. So if you're getting a lot of pain laying on your side, right on the outside of your hip there, that can be some of the muscles of your glutes and even of your pelvic floor that are going out there. And then you can also have, like, if you're having lots of people call hip pain back here. And that's actually sometimes a little bit more what we call SI joint. Yeah, sacroiliac joint. But either way, no matter where it's hurting, there are some reasons why that happens during pregnancy, but there's also a lot of things that we can do in terms of the strengthening, that in terms of the ways that we are moving and the ways that we need to modify your movements during that time, to make sure that we get a maximum amount of like glute activation at the right time so that we can mitigate any sort of hip pain that's coming from there. Again, we just need to make sure that we like for us, you guys have, physicians have differential diagnosis and you're trying to figure out, what's causing what? And we have that just from a muscle and nerve perspective. And so we can really help with a lot of that as well.
Yeah. And I think it's along some of the things that we talked about, especially with tailbone and hip pain. If you've had previous surgery, we have a lot of women who have had pelvic bone fractures from car accidents or whatever, or they had hip dysplasia and they had it early as a child or later as an adult. Those can all be affected by a growing pregnancy, and it can be quite painful. So if you already have a predisposing factor, like you've already had pelvic surgery for whatever reason, you've already had hip surgery, or you have hip dysplasia or something, be proactive and do it early. Okay. Maybe even before you start trying to conceive, getting in contact with a PT to start working on that so that you can get it in best possible shape before you get pregnant would be ideal. So we have to, women I say this all the time. We are so good at planning and thinking about everything else, but when it comes to us,
we're like, nah.
We don't do that. And we need to start doing that more, especially, when we're planning a pregnancy and we know we have these certain medical conditions. We would do it if we were diabetic or had high blood pressure, right? Or if we had thyroid disease, we would want to go to our doctor. What do I need to do? But a lot of times we don't think about our bones and our muscles and our joints, which actually can be one of the more things that can cause the most discomfort and make your pregnancy less pleasurable or pleasant because you're in so much pain. So make sure you get that addressed ideally before you even get pregnant.
Yeah, and another one of those hip pain things too that most people could get exacerbated is a labral tear. If you have a history of a labral tear, right? A lot of labral tears, I think the research shows almost 87% of them are asymptomatic, but there's a lot of changes during pregnancy, right? The changes in the forces that go through your hip change, and so that can re-aggravate something that wasn't a problem before. Same thing with sciatic nerve pain. Everyone's like, oh yeah, well I had sciatica before pregnancy, and then it's like, oh, I'm fine, and then all of a sudden it's like, well,
come back.
And then it's the assumption is poor that you can't do anything about it while you're pregnant, because you can and you should.
And for those of you guys, and I also at any chance I get, obviously it's going to be easier to access care if you have insurance, but there are still a lot of things, even women that are on Medicaid, that we can still do and try to do for you. So just because you're on Medicaid does not mean that there's nothing we can do. You still have to advocate for yourself, and you still, kind of push your doc to say, hey, we got to find someone that can help me with this, because there are plenty of PTs who will take Medicaid, and we can have that available to you.
Yes, so, 100%.
Yeah. Okay, now let's talk about round ligament pain.
Okay. Yes. Now, let me get my little pelvis again. Here we go. Okay, so this is obviously not a uterus with a baby in it, but what there is a little ligament that comes from the outside of the uterus, and it actually goes down and attaches right down into this region. So if you have pain there, you know it, because it's it's kind of like, I can't really touch there in public. Yeah. So it goes down right. So it seems like it's right on the lower part of your pubic bone, right kind of like where your labia is. And it can get really irritated as the uterus grows. Gets bigger, yeah, which is, again, a normal thing. We like that. That's good that that's happening, except for the cool thing about our pelvic PT profession is that there are a ton of things that we can do to help round ligament pain. Sometimes what we have people do is actually get a little bit of a belly support so that there's not as much pressure down on that area. So you have different pelvic PTs have different preferences. I like, at something called the Sorolla SI joint belt, or something called the baby belly band.
That's my favorite.
Yeah, I love the baby.
I love baby belly band. Yeah.
Seriously, because they have the shoulder straps too,
Yes.
and they have the groin ones.
Groin
If
straps,
you get,
yeah.
so I mean, it's like super awesome, and it can be just a regular SI joint belt also.
Mm-hmm.
So that's what we like. That's what we have at our clinic as well. But that can be a good alleviation of some stuff. If we can also do taping techniques around, so we use kinesio tape sometimes, either on the belly itself, or we can tape a little bit of this tissue here to what we call offload some of that pressure and decrease the inflammation right around the insertion point of the round ligament. The other thing that round ligament pain can do is, because it's so close to sort of like right in this region, it can also irritate some of the groin muscles and stuff like that. So now all of a sudden then we're getting round ligament pain that maybe started out like that, and now our muscles of our inner thighs are like, yikes, we're trying to like hang on or protect, right? And then we have groin pain that can, so now we're in like this cycle, what came first, the chicken or the egg. So we definitely have a lot of, no problem.
No, my phone, I just noticed my phone is about ready to die. Well, I don't want to do that. So let me just change it. I'm going to take this out and let y'all know, because I'm having to plug up my battery, and I don't want to, if you can't hear me, well, here.
No, we're good to go.
There we go. Okay. I'm so sorry.
Perfect.
Yeah. Sorry,
Cool.
I just got notified. I was going, okay.
Yeah, totally. So there are a lot of ways that we can help to support the belly and help to support the other muscles of your lower abdomen, even during pregnancy, that can help to offload some of that round ligament pain. So that's another area where we can be a really big help, and it doesn't have to be like, oh yeah, you just have round ligament pain, your uterus is growing, good luck, with that.
So with the round ligament pain, it typically starts as the uterus gets out of the pelvis. So towards the end of the first trimester, beginning of the second, and it can last through most of the second trimester, and then it usually goes away. I've noticed some women never have it. Some women have it when the textbook time is in the second trimester, and then some have it throughout their pregnancy. So every woman's a little bit different. It depends on how their anatomy is, how quickly their uterus grows. A lot of times women with multiple gestation will have it a lot earlier and last a little bit longer. So, and again, that's the two ligaments that kind of stabilize your uterus, attach it down into the abdominal wall and lower into the pelvis. And so as the uterus gets bigger, it puts tension on those ligaments. And there are nerves in those ligaments, and that can hurt. Yeah. So round ligament pain can be pretty uncomfortable.
Pretty
Usually
intense.
You will feel it on, it can be pretty intense. You can feel it on one side more than the other. Sometimes it's helped with position change. But for those women who have it pretty bad, and I've seen some women who do have it pretty bad, again, doing some of the things that Nicole mentioned and seeing a pelvic floor PT, they could give you some advice on how to help that. But luckily it's not throughout the entire pregnancy for most women, although I have seen it. So, but getting that evaluation, it would be very, very helpful, and it's crucial.
Yeah, and I think a lot of times people will be like, oh, well, I'll just wait for that to get better, right? It'll probably go away. But, the other thing I want to point out too is that if during that period of time, you are now restricting your activity level because it hurts, like there's like another, added issue with that. So we really want to get that taken care of to the best of our ability and keep you as active and moving as possible. That's safe, as long as that's happening. Because otherwise then that just like, now all of a sudden during the time when you're in their second trimester, it's supposed to be like, ooh, I can still do a lot of stuff. I don't feel like that bad. Then boom, now you're not doing anything. And now you hit your third trimester and like, ooh, now it's all tired and muscles haven't been working and all that kind of stuff. So just to make sure that we also remember that like sometimes the pain can actually inhibit other things that we want to keep going.
Yeah. And I've definitely seen that as well. Okay, so the last thing I want to talk about is lightning crotch. I did a video on this a while back, and it got a lot of information, a lot of traffic, and a lot of views, and I was like, what? Whoa. But that's because, for number one, people didn't really know what it was or that it was real. And it was like some myth pain, but it is real. And number two, it can happen even when you're not pregnant. So let's talk about first, what is lightning crotch?
Okay, so lightning crotch is typically some sort of nerve irritation that is going down into that area. Now from a pelvic PT perspective, there's actually quite a few nerves that can cause this issue. And that's one of the at least that's part of the fun things of my job, is that we can get one symptom problem and it can be a lot of different things. But one of the culprits is something called your pudendal nerve, right? And so there's a nerve that comes out of your pelvis, and it has three major branches. It has a urethral clitoral branch, it has a perineal branch, and it has a rectal branch. And it can innervate a lot of right around your vaginal opening. And it can cause basically to make you feel like your crotch is on fire and it's burning, or there's shooting pains down in there. So that's number one. Number two, there's also another couple of nerves that are a little bit more sensory that come up, that called your genitofemoral nerve. That actually comes down and innervates some of the genitals here. That actually comes and originates from a completely different part of your back, though. Again, one of those things where just because you have the symptoms of lightning crotch means that like there might be different origins of what's happening there. So that's where a pelvic PT can come in and really help, like, to differentiate, first of all, what's going on, and then how can we get that to get better, even despite your growing baby.
Yeah. So, I mean, it could be because of your posture's changing, the pressure on your pelvis. There's the pelvic floor is full of blood vessels, muscles, ligaments, nerves. That can be a lot of things can be irritated and changed just by your body changing shape, and it can happen. So having a pelvic PT to kind of help tease that out and figure out where the origin is coming from is key, and teaching you better ways to maybe strengthen your pelvis, strengthen your lower back. They might even say, you know what, you need to start strengthening your lower back, your glutes, because all of that kind of is interconnected. And if we're hurting somewhere, we can favor that area and then weaken other areas, which can kind of all create the perfect storm. But lightning crotch is a real thing, and it can be very painful. It feels, I've had patients tell me that it feels like you're getting shocked. It can be because it's a nerve pain. So it can be shocked in your labia, in your vaginal area, around your rectum, up higher by your clitoris, or where your urethra, where you're peeing from. Because like the pudendal nerve, like Nicole said, has three branches and it innervates those areas. So one or many of them can be affected. And I've also had women say that they, even when they're not pregnant, they get that. And that could be from either having been pregnant before, or maybe some other reason that's causing that you have some pelvic floor dysfunction that also could be helped with seeing a pelvic floor PT. So yes, lightning crotch is a real thing.
Totally. And, you know, to like, you know, when you said the thing about that there's a lot of different things, right? It can start out as one thing and then turn into something else, right? Because we had that rectum piece right here that if you're constipated, it could put more pressure and then the nerve gets irritated. Another thing is as the pelvic floor tries to like stabilize, especially into the third trimester, that can sort of create tension around those nerves. So there's lots of reasons for it, but you don't have to live with it even if you're pregnant, and you got to get help for it.
Yeah. And especially, you know, getting help for it while you're pregnant, but even if it persists after pregnancy, make sure you're seeing somebody because to get that worked out, because it is likely something you have pelvic floor damage or irritation that's causing that, and they need to figure out and tease out where it's coming from so they can give you the proper, you know, exercises and things to do to help alleviate that. I couldn't imagine sitting, like I've had patients tell me I'm just sitting there all this and I'm like, you know, you get that shock, and
or rectal spasm or something like that. It's like, yikes, that's no fun.
I was on bed rest, and people have heard me talk about it, for 2 months prior to having the kids, and I have not done the best at getting my lower back and all that. What was I doing? I was standing somewhere the other day, and I went to take a step, and I almost fell because my hip caught, and I was like, oh my God. I'm like, I'm trying to like shake it off, like, nope, you didn't see that.
I know, right?
Know, it does. And I know that's because of my lower back being weak from being in bed rest for so long, having already had the tailbone issue before, you know, carrying twins till 31 weeks. I mean, multiple reasons why that whole area down there could be a mess. So, you know, there are reasons why, you know, we have these issues, but it doesn't mean it's hopeless. It doesn't mean that you're you know, nobody can help you. There's a lot of things at the pelvic floor, and that's why I love talking to you guys, because there's so many things you guys can do, and I'm trying to get the word out there to let women know that you guys are a resource.
Totally. Well, thanks. We appreciate it, because you're right. It's like such a underreported like help that we can give you know?
Yeah. I know. And actually it helps us, because OBGYNs, patients think that we know, and I wish we knew everything. We don't. And I'll be the first to admit when I don't know something. I mean, I was never taught about all these types of things when I was an OBGYN resident, and I deliver babies every day and take care of women. I should know this stuff. So sometimes we have to educate ourselves. And in our defense back then, pelvic health PT and pelvic floor PT was not really a thing.
Yeah.
So, but now it is, so we
Hmm.
need to utilize it.
Yeah,
Okay.
100%.
Yeah. So I'm going to scroll through and see if there's any questions, and then we're going to talk about the discount
Oh,
that you
yeah.
offer. Yeah. Don't let me forget to do that because I always forget. I don't think there's a lot of questions. Everybody's pretty much just saying,
Yeah, thanks.
good talk. Yeah.
Awesome.
Let's see. That's everybody that's joining. There was one question. Oh, Nicole rocks. Okay. Yeah. Yeah, and the doula. Oh, she was talking about.
Oh, the
This is
pooping thing.
pelvic
I think I
perspective. Yeah,
saw
the
that
pooping.
come through.
Yeah.
Yeah.
So
She's going
our
to be on your thing.
she no, we already talked. We talked. I think it was last weekend.
Oh,
Yeah.
cool. Okay, cool. I have to watch that.
Harper Catherine says, are issues of pelvic floor related to having an irritable uterus? I'm not sure what an irritable uterus. So what I'm guessing she's saying is like a lot of times women will come in because they're having what they think is contractions, and it's actually what we call uterine irritability. And
Mm.
that's, where, if you put a woman on the monitor and she's having contractions, you'll see a contraction pattern, right? And
Right.
sometimes we see this little uterine irritability, which aren't really coordinated contractions, is just irritable. I don't know that contractions or, having pelvic floor dysfunction is going to cause uterine irritability per se, but it could be vice versa. If you're having a lot of uterine
Yeah.
irritability and you're uncomfortable and you're guarding yourself, that could cause your pelvic floor to kind of tense up and cause other things. So I think it's probably the reverse.
Yeah, I would say
Yeah.
that that's totally true as well. And the other thing is that, especially if you're having uterine irritability, when you're like not really, if it's scary, right? I mean, that can
Yeah.
be a scary thing. Then it's like, ooh, then that can, again, with that guarding, with the fight, flight, freeze response, being like, we got to hold back. This isn't supposed to be happening, and then we can get that tension in the pelvic floor from that reason. Mm-hmm.
Yeah, so Tessie Morales is asking, what do you recommend for someone with pelvic floor dysfunction, a C-section or a vaginal delivery? Okay, so I will take from the OB standpoint. I am of the firmly stand behind there should be a medical indication for a C-section. Pelvic floor dysfunction, unless you've had some kind of major surgery, a major hip surgery, and you can't flex your hips in order to push. If you had a pelvic surgery that doesn't allow expansion of the pelvis and the baby to come through, I am all for doing a vaginal delivery. If you already have pelvic floor dysfunction, and you're someone like that, I would start seeing someone like Nicole beforehand or while you're pregnant to try to facilitate having a vaginal delivery. It's very, I would need more of an indication other than that, but I don't know your whole story. Would you agree?
Yeah, 100%. And pelvic PTs, I'm always like, you need to talk to your OB about that. However, I think it's also a misconception, like that a C-section is going to save your pelvic floor, because it's like
about that. Yes.
It's six of one, half a dozen of the other. And again, unless there's a medical indication why you should choose a C-section, then I feel like I'm with you on that as well. And I mean, at the end of the day, in a very perfect world, and we all know, especially 2020 has taught us that it's not perfect, but I think that getting the concept too of prehabbing a pregnancy can also be really great, right? You can get like what is going on physically from that standpoint. If you already have a pelvic pain condition like interstitial cystitis, endometriosis, anything like that, if you have a history of low back pain, hip pain, then, if you get pregnant and you haven't done pelvic floor PT before, then that's fine. There's not like scary, nothing's about that. But you can also use that as like, if I'm going to go through, 10 months of a big time change to that area, then we might need some help before, we might need some help during, and then we obviously will need help after as well from somebody that's trained in this area. Yeah. So that's a great question, but pelvic floor, and the other thing that I say to people too is that our bodies are meant, I mean, there are special receptors, those pelvic floor muscles are meant to stretch in different ways. They have special hormone receptors there, that it's not like it's your bicep getting into that position, right? So that's where you have a little trust for your body that can do that, and we can sort of help anything along the way as it comes.
Yeah, and then there was one last question about getting a referral, and as Nicole said earlier, you don't necessarily need to have a referral. But you can always start with your insurance and see if it's, you know, if it's necessary, but most of the time it's not. You can do that on your own. But many times if it's something related to pregnancy, they may ask to get in contact with your doctor to come up with a treatment plan and let them know what's going on.
Yeah.
You know, anytime you're getting, not just PT, anytime you're getting care from somewhere else while you're pregnant, it's always important to let your OBGYN know. So that we're not, you know, we have no idea, you know, that you were getting seen for something else. It's always important to let them know, all members of your healthcare team know while you're pregnant who's actually treating you.
Totally. And, you know, pelvic PTs, you know, one of the big differentiating factors that we do is that we are able to perform an internal evaluation of the pelvic floor muscles. And so we typically don't do that in the first trimester. But once you get clearance, if you're able to have sex and your OB says it's fine, we can actually still assess the pelvic floor muscles internally. Assuming everything's going okay. And then, you know, there are also external ways to assess the pelvic floor also. So there's a lot of different ways for your pelvic PT to be involved during your pregnancy.
Perfect. Okay, so we're gonna close up here. I wanted you to talk a little bit about what the giveaway is and the discount that you're offering. For babies after 35. Yeah.
So at my clinic, Pelvic Sanity, we always talk about pelvic health foundations, right? The foundations of pelvic health. We believe that they're where it's nutrition, movement, sleep, and nutrition. So those we feel like are the pillars of pelvic health, where if you you know, one of those on a stool, if one of those is like a little wobbly, your pelvic health could be like a little bit down. So we're in the process of creating all 4 courses on just simple like pelvic health foundations for sort of any ability. And one of them is a pelvic health foundations movement course. And so for anybody that's watching this, any of your followers, we have a coupon code, a discount code that you can use. So we'll give you the link, and we can put the link here in the comments at the end of this, but it's pelvicsanity.com/foundations. And then if you get the movement course, then we're going to have a discount code for babies after 35 is the discount code, and you get $10 off. So it puts it down to just $19.
Perfect.
Yeah.
All right, I'm writing this down, so I'm going to put it in the thing as I end this video. So cool. So you go to you said pelvicsanity.com/foundations. Go to the movement course, and you can get $10 off, which will make it $19. Yeah. So I would recommend
it's for like it's basically just general pelvic floor health. We go over hip mobility, spinal mobility, actual pelvic mobility, and then ankle mobility, which most people don't think is related to your pelvis and pelvic floor, but it is.
Sure.
So it's kind of cool, and it's pretty ubiquitous. Anybody can do it. You might have to do a couple modifications if your belly's real big, but it's pretty safe for everybody.
Yeah, so I'll put it in this video. The video will be on my Instagram TV, and it'll be in my stories and on my feed. So you can get the link there. I'll make sure and put it in the description. So thank you, Nicole, for your time. And go to pelvicsanity.com to get other information too, not just on the course. It is a good resource. And tell them again where they can find you on Instagram.
Yes, on Instagram, it's this channel, Nicole Cozean DPT, or Pelvic Sanity. And those are the 2 things that we're mostly on with Instagram. And we just thank you so much for raising more awareness about pelvic health PT. And I think that the cool thing about this, right, is that it's always, there needs to be a collab between physician and pelvic health PT, right? We can't operate in isolation for a body that's so complex. Yes. So I really appreciate that aspect of what you're doing. It's really awesome.
Thank you, and I appreciate
TikToks.
And all the TikToks. Yeah, I know. I don't do TikTok for TikTok. I do TikTok for Instagram.
For Instagram, yeah, totally.
I totally do. Yeah, this is my home. Instagram's my home, so this is where I put all my stuff. So. But anyway, have a good rest of your weekend. Enjoy your week. And thank you again so much. And if you guys want to go find out more information from Nicole, you know where to find her. And I'll put where you can get the discount for the Pelvic Foundations Movement course on this video.
Perfect. Awesome.
Thanks, guys.
Thanks so much.
Bye-bye.
Bye.